He was accused of fraud and his techniques were called unscientific. Whether he practiced hypnotherapy directly or his subjects underwent a form of self-hypnosis, he is included in the history of hypnosis by many scholars. Around this general time, Scottish surgeon James Braid, 1795–1860, was practicing in England. He became aware of many of his patients experiencing a trance-like state when they kept their eyes focused on the one spot for a period of time. He introduced the words hypnosis and hypnotism to the medical fraternity. He stated that hypnotism was a scientific and psychophysiological discipline. James Braid and another Scottish surgeon named James Esdale, 1808–1859, validated the use of hypnosis prior to surgery. They recognized the benefits for patients and were among the first doctors to have hypnosis accepted by their medical peers. During the mid-1900s, Milton H. Erickson, 1901–1980, was a well-known psychiatrist who used hypnotherapy in his practice. In 1958, both the American Medical Association and the American Psychological Association recognized hypnotherapy as a valid medical procedure. Since 1995, the National Institute of Health has recommended hypnotherapy as a treatment for chronic pain. The earliest known healing use of hypnotherapy was by the ancient Egyptians and described in hieroglyphs. Much later, a Frenchman called Charcot, who was in charge of so-called hysterical patients in a French mental institution, often epileptic, noticed that he could put them into a form of trance, which appeared to help them relax and even improve. He developed this over some years, and Freud came to study with him for a time. Freud, however, was not good at hypnotherapy and dropped it in favor of the psychoanalysis he later became famous for. In the early 1800s in Britain, a Scottish GP named James Braid based his work on the common sense psychology school, which required a scientific, evidence-based approach. He had no time for the light entertainment style of Anton Mesmer's stage hypnosis, after whom the word mesmerizing was named, or any other esoteric notions. Dr. James Braid is now justifiably becoming well known again after many years of being overlooked as a leader in the field, and is a heavyweight in the study and modern origins of hypnotherapy, with several serious books to his credit. An American named Milton Erickson is often described as one of the founders of modern hypnotherapy in the 20th century. He became a professional psychologist as an adult, after becoming fascinated by and making close observations of his large family's behavior when bedbound as a teenager with polio. His empathy with clients was renowned, and he had a gift of seeing where their problems really stemmed from and finding effective and original solutions. With the rise of psychoanalysis in the first half of the 20th century, hypnosis declined in popularity. The modern study of hypnosis is generally considered to have begun in the 1930s with Clark Leonard Hull at Yale University. His work Hypnosis and Suggestibility, 1933, was a rigorous study of the phenomenon, and important because perhaps for the first time statistical and experimental analysis was used. Several studies further demonstrated that hypnosis has no connection with sleep. Hypnosis is not sleep. It has no special relationship to sleep, and the whole concept of sleep when applied to hypnosis obscures the situation. In the 1950s, the medical profession started to use hypnosis for therapy. In 1955, the British Medical Association recognized hypnosis therapy, and in 1958, the American Medical Association approved a report on the medical use of hypnosis. 2 years after AMA approval, the American Psychological Association endorsed hypnosis as a branch of psychology. Dave Ellman was also one of the latter-day pioneers of the medical use of hypnosis. Ellman's definition and hypnotic techniques are still widely used among many professional hypnotists. He is known for having trained the most physicians, dentists, and psychiatrists in the use of hypnotism. He is also known for introducing rapid inductions to the field of hypnosis. One method of induction which he introduced more than 50 years ago is still one of the favored inductions used by many practitioners today. In conclusion, we must just mention the introduction and development of NLP by Richard Bandler and John Grinder in the 1970s. NLP was created, in large part, by its two founders studying, understanding, and developing the methods used by Milton Erickson in psychotherapy. NLP is a set of tools and techniques for self-improvement, using our neurology and thinking patterns, our way of expressing our thoughts through language, and their influence on us, linguistic, and our patterns of behavior learned through experience, programming. There is a direct link, through Milton Erickson, between NLP and hypnotherapy, and many of its techniques employ the use of trance and can be used with hypnosis or as an aid to hypnotherapy.